If you are preparing for birth, you have probably heard about perineal massage, but no one really explains how to actually do it, when to start, and whether it even helps or not. So let's start with the truth. Perineal massage is one of the most commonly recommended tools for birth preparation, but it's not a magic solution, and it's definitely not something you should do in isolation. I like to think of it as one piece of puzzle. It works best when combined with breathing techniques, pelvic floor awareness, and hip mobility exercise. Because your body needs to learn how to create length in two ways. One, actively through movement and breath, and second, passively through stretch. So what is perineal massage? It's a gentle, passive stretch of pelvic floor muscles, usually done by inserting a finger or a tool into the vaginal canal. And this is important. This is passive technique, meaning your brain isn't actively controlling the stretch. During childbirth, your pelvic floor needs to stretch significantly, and most people have never practiced that. We are used to tightening, holding, bracing, not softening and releasing. So before you even start stretching, you need awareness. Can you feel the difference between Kegel, a lifting and tightening of the muscles, and a full relaxation? Because birth requires the opposite of holding. It requires letting go. When you're ready to begin, make sure your hands are clean and use a good water-based lubricant. Gently insert your finger or your thumb into the vaginal canal and then apply the downward pressure towards the perineum. Like you want the stretch intensity about 3 to 4 out of 10 on a stretch intensity. Not pain, just a stretch. Hold this for 30 to 60 seconds. This sustained hold is important because your muscles need time to lengthen. Next, if this is a clock, this is 6 o'clock, this is 4 o'clock, and this is 8 o'clock. So apply the same pressure and hold for 30 to 60 seconds on 4 o'clock. Then repeat the same thing on 8 o'clock. Put the pressure, hold for 30 to 60 seconds. And once you are done with all these three areas, repeat the cycle again. And then you can add gentle sweeping or gliding motion from like 3 o'clock to 9 o'clock and keep doing this for 1 minute. This helps to increase the flexibility further. And the most important part, don't hold your breath, relax your jaw, relax your shoulders. If your body is tense, your pelvic floor will stay tense too. I usually recommend starting this around 35 weeks of pregnancy, practicing every other day. The full routine takes up to 6 to 8 minutes. You can try it in different positions, like reclining with the pillows on your back, yoga block or pillows supporting your knees, and reaching to your perineum. Other position is the supported squat. You don't want to be actively squat where muscles are all tensed up. You can use the yoga blocks or a step stool and sitting on it and then reaching to the vaginal canal. Or you can use the side lying position, supporting with the pillows and going into the side lying and reaching to do the perineal massage. And here's why this matters. Different positions give you different feedback about your body. Some positions will feel easier to relax into, and those might be actually helpful for your birthing. This is also a great way to notice case emotion. If one side feels more tighter, you can work more on that side. That's a valuable information. And if reaching to the vaginal area is difficult, you can use tools like pelvic wand, dilators. Also, your partner can help, but only if it allows you to stay relaxed. Is perineal massage about stretching tissues? Yes, but also no. It's about teaching your body how to accept stretch instead of resisting. Because birthing isn't just about pushing. It's about learning how to release, how to relax your pelvic floor muscles. Happy birthing and happy pushing.